have been able to see what we have achieved together over these last few difficult months. Indeed, as I did indicate during the third extraordinary session of the summit on the 10th of June, whenever we gather as a summit, the conscience of our entire nation is actually called to order. The political dynamics of the moment are put asunder, and our only business becomes Kenya. Indeed, I am further reassured by the fact that each time this gathering is convened, it becomes a fellowship of truths. When we sit, we speak as one, not because we are always in agreement, but because we are not afraid to tell the truth. So we approach our issues surgically and make prescriptions that sometimes hurt in the short run, but heal in the longer run. And that is why I want us to be brutally honest with each other today. And we must begin by asking the uncomfortable question regarding our response to the COVID-19 pandemic. We must ask ourselves whether we have done our best to contain its spread. Then we must ask further whether what we consider to be our best is enough. Are there areas we fall short, and could we have done better as governments? We must ask ourselves, from the time we opened, did we backslide from our vigilance when we started flattening the curve? And are there lessons that we can learn from this relapse that has occurred during these recent months? We must also ask ourselves about our staying power. Do we have the stamina to take us through the uncertainties of this pandemic, or are we succumbing to fatigue visited upon us by this fight? Ladies and gentlemen, the nation is not asking us to follow it, but rather asking us to lead it. And if people have backslidden from the resilience they showed during the first few months of the pandemic, they do not expect us leaders to backslide as well. And if the nation is succumbing to the fatigue created by the virus, it would be a tragedy if we as leaders give in to the weariness as well. And if the people have fallen short of giving their best, we as their leaders have to give our best. This moment provides a unique call to leadership. Although health interventions are critical to fighting the rising COVID numbers, leadership is what will reverse this escalation. And you, as the leaders of our 47 county governments, all know that leadership is not a position, it is the actions that we take. In a situation of crisis, action also means knowing the way, going the way, and showing the way. And that is what is expected of us as leaders, both at the national and county level. And I am persuaded that if we exercise collective leadership in this fight against the pandemic, we will reverse the upward surge of new infections. And while at it, we must not be pushed to make popular decisions to appease the public. We must choose the bold over the popular, if that is what shall serve the country better. Ladies and gentlemen, I want to identify only 3 elements of collective leadership that we must engage in. In choosing the 3, I am cognizant of the fact that health interventions are critical to our fight against COVID-19. However, the paradigm must now shift from emphasis on health interventions to underscoring the management of human response to this pandemic. If we are experiencing an escalation of infections countrywide, it is not because our healthcare system has failed. The crisis is as a result of failure to manage our human response to this pandemic, and this is what this conference must address. The first element of leadership that we must focus on is compliance and enforcement. If this summit is a fellowship of truths, we must admit that there is a collective failure in the area of enforcement. Although the wearing of face masks in public is now a statutory requirement, we are facing enforcement challenges across the 47 counties of Kenya. Marketplaces, trading centers, open-air pitches are full of crowds without masks. For the most part, this is not because the crowds cannot afford the mask. It is a problem of our two levels of government failing to enforce compliance to the COVID protocol. Other enforcement challenges include curfews and not meeting curfew times, public meetings, and also drinking places. On curfews, we erected checkpoints with the hope that they will become a deterrence for unnecessary movement, but in some instances, the curfew enforcement points have become outlets of corruption and unjust accumulation. The question to this summit, therefore, is this: is there a way that the national government could have coordinated better with county governments to arrest such eventuality? Or is there a way we could have provided collective leadership to arrest the unexpected consequences of our roadside rallies and bars that have remained open beyond required timelines? The second element requiring our collective leadership is that of early warning and early response. Like enforcement, this is the domain of human response. For instance, today we have counties that do COVID testing, and they have their samples, they have to send their samples to neighboring counties for analysis. By the time the results are back, the infected have interacted for 5 days or so with non-suspecting victims, spreading the disease as they await results. Yet the World Health Organization has approved a faster way of testing COVID-19 using pre-qualified anti-agents that give you faster results in your locality. So instead of sending samples to other counties, each county can use this WHO intervention to localize testing at the county level. But for this to happen, leadership has to kick in. Leadership at the county level has to know the way, go the way, and as I said, show the way. It has to identify the solution provided by WHO for quick testing, acquire it, and implement it on the ground. The quick acquisition and deployment of the WHO pre-qualified testing kit, I believe, will make the difference, and we must make it prevalent in our counties as part of our collective leadership and responsibility. The third element has to do with our immediate irreducible minimum. Yes, we can manage the human response to the pandemic through enforcement and early response. However, this has to tie back to what we identified in March as our COVID-19 irreducible minimums. Although this is not part of the human response, leadership in ensuring that these minimums are met is critical. We must be truthful to ourselves on this. Do we have the irreducible minimums to handle the turns and twists of this pandemic in our counties? Do we have enough isolation beds, ICU facilities, oxygen equipment, and the bare minimum of 300 bed capacity? If we have to meet these requirements, should the pandemic demand that we expand our health facilities in the coming months, do we have what it takes to do so in a speedy and timely manner? The question I want us to ponder in this conference is, do we and are we prepared for the upsurge that is likely to happen? I have one last point of reflection, and I want to invite you to consider this in the summit. The COVID-19 has put pressure on our education system and calendar. Collectively, we need to come up with leadership solutions that provide us a feasible way forward. This will not be a national government affair only. It requires the involvement of all of us. As we deal with enforcement, early warning and response, and ensure that the irreducible minimums are in place, we must not leave the education sector behind. Innovative thinking on how to reopen our schools and learning institutions must be a shared responsibility between the national and county governments. So therefore, colleagues, I invite this summit to make bold and once again, maybe not so popular decisions. And I implore you to focus on your role as leaders, not managers. Let us look at the big picture and how it will affect the country and your role in coming up with solutions to solve the problem. But fundamentally, focus on how we can enhance our human response to this pandemic in the areas of enforcement, early warning, and response, and ensuring countrywide irreducible minimums are met. I therefore wish you all and us fruitful deliberations with solutions that will help our country navigate this second wave of this pandemic. But fundamentally, I wish you a very truthful session of deliberation. Asanteni sana, Mungu awabariki. And at this juncture, I would like to invite my co-host or my co-chair, the Honorable Wycliffe Oparanya. Wycliffe, you have the floor. Yes.